Well, firstly, thank you for the invitation to present today. Um, just as a bit of background, in order to give some context as to my involvement and my background, I am an exercise physiologist and a dietitian. I trained some 25 odd years ago. I have had significant experience of driving change from within. So I took the perspective that I would come within food industry and see how I could drive change, and have been doing that since we started our first sodium reduction program, which was back in 1997, when we started reformulating the sodium of our foods. I have had 21 years at Kellogg, and I'm in the top 100 leaders of the company, and I report into our global leadership team. So I can have a voice at the table to help our leaders understand what they need to do. I have an in-depth understanding of cooking. I cook a lot of my foods from scratch in order to understand what cooking does to foods, food technology from my work within industry, and also an in-depth knowledge around why people eat, mostly driven by the consumer research that we do, but also my fascination with understanding food through history, understanding the sociology of food, etc. I helped to develop, well actually I led the development of the daily intake system in ANZ, and in fact Kellogg Australia was the first company to actually develop that system, and then got food industry to follow. And then worked closely with Michael on the technical working group for the Health Stars in ANZ and others across the Australian nutrition community to help to work to develop a system which we felt would be very helpful for consumers to make decisions about food. Very quickly, we have been on a renovation journey with our cereals and also our snack foods. You can see there some of the numbers of sugar and salt that we have taken out of the food supply, and some of the numbers of the amount of fibre. And I want to stress cereal fibre from grains that we have put into the food supply. More recently within Nutrigrain, it's an iconic cereal here, which tends to have higher sugar levels. We have been on a sugar reduction journey with that food. We have a significant percentage of our portfolio which is a source of fibre based on grains, and also a significant number of our portfolio which has 4 stars or higher. And we continue on a journey to improve our foods, both here locally but also globally. I think one of the points that we want to make, and Mike's done a fabulous job in summarising some of the different systems, as have all of the speakers in depth. I think the challenge for industry, particularly multinationals, is the different systems that we need to look at in country. And the challenge is when you don't have nutritionists within industry to help the company understand how to apply those systems. And it's perhaps a call or a thought for people to consider, is there any way that we can create consistency of systems across countries, taking into consideration the fact that dietary choices are different in country, and dietary makeups are different in country based on local preferences. But is there an opportunity in 10 years' time where we may have a singular system globally? So just a challenge for people to consider. I know the Health Stars, Cleona has already covered the Health Stars system in depth. One point that I'd like to bring up, and one of the reasons why we have had a single colour within the Health Star rating system, is to try to reduce costs of printing of that system on pack. Because to put a multicoloured system, it's much more expensive to do coloured printing, as you would know from your own internal coloured printing at home or in your office. And so black and white printing makes it easier and less costly to make changes to your packaging. So just something to think about as you also consider different systems. If we think about front of pack labelling systems from what I've seen and from what industry look towards, because at the end of the day, we want a system that seemed to be by consumers credible, and also something that we want consumers to understand. I really would like to push for having a credible scientific approach behind these systems so that it's validated and we know that, number one, that it works to sort foods according to dietary guidelines and where we want to move this food supply to. But number two, it builds trust and consideration by consumers in the system. I think it also needs to be practical and attractive. Consumers need to be able to understand the system. So the complexity of the system makes it hard to explain. And sometimes when you have multiple factors on the front of pack, so say for example, a green sugar, a red sodium, consumers do get confused with regard to which they should look for. So that's why some of the systems like Health Star system, which is a whole of food system rather than a specific nutrient system, can be more easily understood by consumers. It needs to be equitable across food categories and also food sectors. There's no point having a system that unduly promotes one sector versus another and sets up a food category as better than another unless it supports the dietary guidelines. Critically, it needs to enable differentiation between food products. Again, how can you make the system sensitive enough that it pulls out the differences within foods so that consumers can clearly understand what's a better for you choice and what's something that they might only have occasionally or from time to time. It needs to be clearly understandable to consumers, and we need to do a lot of research with consumers prior to adoption of front of pack labelling systems to understand both comprehension of the system, what is it that they understand by the system, but also understand uptake by the system, and thirdly, whether it'll make a difference to purchasing decisions. We see a lot of work that we do with consumers where consumers say one thing, but they do another. And it's critically important that we start to understand how do we get to what they do with our research that we're looking at versus just what they say. Because you can have the healthiest food in the world. If consumers don't eat it, it's not healthy. And there's we find a lot of struggle with putting forward healthy products. The consumers say they will pick that up, but then when it goes to market, consumers actually don't do what they've told us in consumer research. Critically, it needs to be supported by governments with education. The front of pack labelling system is no good unless people understand it and unless the government educates right through from the school children right up to the adults that are making the purchasing decisions. As Cleona and others have said, and Chantel has done some great work over in France to show the effectiveness of systems, but it does need to be monitored for effectiveness to allow improvements. Science is constantly changing. We need to make sure that we make improvements to keep pace with science, but we can't always get things 100% right when we first launch it. So how do we then change it without creating unintended consequences? And then the last point is it needs to be supported by all stakeholders. There's no point having a system which is undermined by people, particularly publicly, because it just has consumers confused as to why the system was developed in the first place. I think we do need to have dialogue about the system and how we can improve it, but we just need to be careful that through having that dialogue, that we're not then undermining the system with consumers. So what are the best mechanisms to do that? Some considerations for front of pack systems based on my experience and also based on having seen the different systems around the world and working within the industry from an industry perspective. Understanding and impact. There's no point having a system that people don't understand and that has no impact. So how do we set up consumer research at the front end to make sure that we've addressed that? Consistency. Can we, as I said before, create consistency? In Australia, we've had a number of different systems. So National Heart Foundation, we've had daily intake, we've now got Health Stars. How do you actually get consistency over a period of time in order to help to drive understanding? A point around being very careful how much focus there is on nutrients versus ingredients, and being very careful that we're not driving the food supply to a homogeneous food supply versus a heterogeneous food supply. I'm going to give an example on that. So we have foods that are based on corn, and as we all know, corn is not particularly high in dietary fibre. It's not a grain that you would go to first as a fibre source. Wheat, on the other hand, is very high in dietary fibre in that grain class. So by pushing for dietary fibre, are you then pushing all foods to go to a wheat base? So we need to think about that as we're designing systems in order to understand what we do to make sure we keep variety in our food supply and in the foods that consumers eat and the foods that people are offered. Nutrient versus ingredient. Be very careful of the unintended consequences of going too hard on a nutrient. It's something that I call trans fatting of the food supply. The food industry come up with solutions to reduce sugar, which may lead to the use of artificial sugars. Food industry find solutions to increase fibre, which again may lead to the use of artificial fibres. Be very careful what you want as an outcome, because food industry will, rightly so, find an opportunity to meet that. But what you don't want to do is create something that's worse than what we currently have. And that's what I mean by the trans fat example, where we tried to reduce saturated fat in our foods. We solidified a vegetable oil that created trans fats, and research showed that it was worse, and we've had to take all of that out. The final point, which I'll discuss in a minute, is whether you have it front of pack labeling as a stand-alone education or whether it's part of a comprehensive educational program. And by a comprehensive educational program, one idea I would like to leave us all with is, how do we get front of pack labelling to be part of the puzzle, and how do we get governments to focus much more on the three-step education process? Because dietary guidelines that we currently have show people what they should eat, and it's already created. And so the first thing consumers need to understand is what is the foods they should eat most of and what foods they should eat least, and that's where the dietary guidelines come in. The second part is there are guides to healthy eating, which is essentially the meal plans that we create as dietitians that are based on, I suppose, model diets in order to get the best health outcomes, which show you how much to eat, including the serve size of the foods and the number of serves. With that system, you then add the front of pack labelling system, which when you're in the shop and at point of purchase, it shows you what in that food category is the better for you option. Because you've had the information on what you should eat, how much you should eat, and the number of serves, the front of pack labelling is almost like the icing on the cake that then shows you the better for you food within that category to choose. So finally, I'd like to say thank you and pass back to Michael for Q&A. There's some considerations from industry, and I'd like you to encourage you to consider, I suppose, working with and talking with your nutrition colleagues that do work within industry, because I think we do have significant experience to provide, both in terms of the food technology perspective, the consumer perspective, and just learnings on how potentially we could all work together to achieve the best outcome. So over to you, Michael.